Can you guys see my screen?
Yeah.
Okay,
Yeah.
so we have 500 milligrams of Levaquin. And then what?
The drug comes mixed in 100 milliliters of normal saline to be infused over 30 minutes. How many drops per minute should you infuse using a 15 drop per milliliter IV set?
I have it somewhere.
How many? 15?
Yes.
So it's asking for drops per minute.
Yes.
Mommy, the sun come down.
Yeah, leave the sun. I'm doing.
All right, guys, if the kids come in, just mute for me. Good job at doing that quickly. Okay. So now it's asking for drops per minute. Okay. So what you always want to do is look at the question. What's the question asking me for? Drops per minute. So for drops per minute, what is our formula? It's volume times the drop factor over minutes. Okay, so in this case, we have 100 mLs. Over 30 minutes, because our time's already in minutes, so we don't have to do anything with that. And our drop factor is 15, right? So 100 times 15 divided by 30 should be your answer. I don't have the quiz in front of me, so I don't know what the answer should have been. Do you have what the answer was?
I do not have what the answer was.
I should have that answer somewhere.
This was,
It's 50. It's 50. The answer should be 50.
let me just see if I can pull that. This was the most recent quiz you're talking about, right?
Yeah.
Number 6 in the most recent quiz.
Yes.
So you got
Yes.
50, nurse?
Yes, I did.
Did everybody else get 50?
Yes.
Yeah, I got 52, yeah.
Yes.
Thank you.
Let me go to the calculation itself, see if I can find, oh, you know what? It's easier to go this way because they don't have them labeled in here for me. So I have no idea when I look at the quizzes, like which week is which,
Mm-hmm.
because of the way they put them in there. So I got to go, if I go to week 5, it'll be easier. Week 4, week 5, here we go. Dosage calc, number 6. Yep. Okay. That's what they have there.
All right.
Anybody else? Everybody else is good?
Yeah.
Okay. Can you see my screen?
That's
Not yet. Yeah, now we do.
Yeah.
Don't know why it's not working. Let me see what's going on here. Try it again. I guess it's taking a minute for it to populate. Let's see. Hopefully it's going to work in Zoom. You guys can see it, right?
Yes.
Yeah.
Yes.
Yes.
I've never used this in Zoom before, so. Maybe I have to use it not as a slideshow. So stupid. Okay. We're going to have to try it another way. All right. Okay, so here's your first question. The physician has written the following orders for a client. Carbenicillin, 500 milligrams IM every 6 hours. Medication requires constitution. The label information indicates that the vial contains 2 grams of carbenicillin when reconstituted with 5 ml of sterile water to yield 1 gram per 3 ml. How many ml of the reconstituted solution should the nurse administer to the client? So always read your question first. It's asking you how many mLs that you're going to give here. So your formula has to be in mLs. Okay. Now, when you're doing reconstitution, how many of you know the formula for that? I sent you guys to practice. So has everybody been working on that?
Reconstitution.
I have it.
So remember, we're doing desired over need, right?
Mhm.
We're always doing desired over need for the most part, especially on a question like this. So it's telling you that when you get done adding this water, and all you have is you got this package from the pharmacy, right? And in the package, you get this bottle of powder. And now, in order to make that medication work, you're going to have to add some water or some normal saline or something to that bottle in order to turn that powder into a liquid so you can inject the patient with it. It doesn't matter how much water you add to it, because what matters is what is the concentration after I add the water. So our concentration after we add the water is 1 gram per 3 mLs, because it says that's what we're going to end up with, is 1 gram of carbopenicillin to 3 mLs of our water. Okay, so that's what we have on hand. Now, what do we need?
Milliliters.
We need 500 milligrams, right? Because that's our doctor's order.
Mhm.
So we simply take our doctor's order, which is 500 milligrams, and we put it over what we have on hand.
Which is 1,000 milligrams, because you have to change the grams to milligrams, right?
Yes, ma'am.
Yes.
So we have 500 milligrams over 1,000 milligrams per 3 mLs, right?
Yeah.
So this is what you should ultimately have here.
I mean, you multiply it by the 3, right?
Yes.
Yes.
Okay. Just wanted to make sure.
So we have 1,000 milligrams. Now, what was the other one? It was a gram.
It was a gram. It
Was
was
a gram.
500 milligrams.
Everybody knew you had to take that 1 gram and multiply it times 1,000 to get your milligrams, or move your decimal point, right? 3 places to the left, 1, 2, 3, or the other way. My bad.
Right. Yeah. Okay.
My other left.
Yes.
Okay, to get your 1,000 milligrams, all right?
Yeah.
Oh, this was 500 on the top. I'm sorry, not 1,000.
It's 500. It confused me.
Sorry. My brain works faster than my fingers sometimes. All right, so we have 500 milligrams because this is our doctor's order, right?
Yeah.
Or our desired dose. What we have on hand is 1 gram or 1,000 milligrams for
1,000.
3 mLs.
Yeah. Times 3 mLs.
Okay, so you take the 500, you divide it by 1,000, and you multiply that whole thing times 3, and what'd you get?
1.5. 1.5.
1.5.
5.
1.5.
Okay, anybody get anything different or not understand? Okay, so 1.5 was your correct answer, A.
Where is the 1,000 from? What I can see is 2 grams of carbopenicillin. Where is it?
Yes, ma'am, let's do it again, okay? So, our doctor ordered 500 milligrams, right?
Mhm.
We added water to what we had, and that gave us 1 gram per 3 ml of a concentration of carboxylin to water. Do you understand that part?
Yes, I do.
Okay, so now we're going to take that 1 gram and we're going to convert it to milligrams because our doctor ordered 500 milligrams, right?
Yeah. Yes.
And we have 1 gram, so we have to do a conversion either with the physician's order or with what we have on hand.
It's okay now, it's clear. But so we are going to disregard the 2 grams of carbopenicillin part of the question, right?
That's extra information to confuse you. That's what they
Yeah,
throw in
that's
there.
just an extra
Yeah.
information.
It's
All
not
right,
really to confuse you, because when you get the box from the clinic, okay, it's going to say this on it. It's going to tell you on the label that there's this in there. Let me just see if I can pull something up for you guys real quick so I could kind of make it a little clearer for you.
Okay.
Oh, come on, be nice.
The messenger molecule carries.
So can you see my screen?
Yes.
So when you get the medication from the pharmacy, you'll look at the label on the bottle and it's going to say something like this. And it's telling you that you have this 150 milligrams of powder for reconstitution, okay? And then when you open up the exhibit, there'll be instructions in there. So this exhibit is kind of the same thing that you would see. You would get this packaging insert that says this on it. For IV route, reconstitute the powder with 0.9% sodium chloride for injection. And then you'll add 5 mLs of diluent to each 150 milligram powdered vial. Then add the solution, the 145 mLs of 0.9% sodium chloride to the infusion bag and mix well before administration. So this is what you're going to get when you actually get a package on the floor. And so that's why that 2 grams is in there, because you will see that. It's not really just fluff. You really will see those instructions whenever you get something on the floor that you need to reconstitute.
Yeah, only reason why I said it was extra information that you didn't need was because they put it in there that it confuses the problem. It takes you away from what you need, desire over have. That's why I said that.
But
I
it's
know you
actually
need it, Miss
part
Sue.
of the whole solution. And I just didn't want you to think that, you know, nursing exams aren't really put there. They don't really put questions in there to try to trick you or confuse you. Like, that's not really the purpose. We're trying to give it to you as close to real life as what you're going to expect to see when you get it on the exam. I mean, in real life, not on the exam. All right, because that's what NCLEX expects you to know, like safety-wise, that you should be able to read that. Okay, where'd my other screen go? Oh my.
God, these days are fucking catching me.
That wasn't the one we had up, though. Did I lose my whole PowerPoint, I think. All right, let's try this again. I don't know where my PowerPoint went to. It's crazy. Okay, come on, screen, be cooperative. This Zoom makes it so hard to work things. It just don't want to be cooperative with me. Okay, let's try it again. Let's stop the share. Open up the PowerPoint. That should be the PowerPoint there. Oh, come on. Why won't it open back up? Finally. Okay. Why it has to be so difficult. Okay. Now, you guys probably saw something like this already before on an exam, right? So we have gentamicin sulfate, 80 milligrams in 100 mLs of normal saline. And it's to be administered over 30 minutes. The drop rate is 10, and you're going to set the flow rate at how many drops per minute? Everybody know how to do this one?
No.
Okay. Let me put these people in, and then we'll show it.
Do you want us to answer these or just wait?
Well, I want you to answer them, but I also want to show the people that don't know how to do it,
So just put
how
it
to
in
do
the
it.
chat, maybe? Okay. Oh.
So, and then you'll know when we get done. I'm sure you have the right answer if you know the formula. So again, the question is asking us what? What's the question
Drops per
asking us?
minute. Can they what?
Okay, drops per minute. Okay, so we know we need two things, right? We need our volume, which is what?
100.
So our volume is 100 mLs. And when you're looking for volume, you're looking for mLs because that's your liquid volume. So if you're not sure, look for something in the statement that has mLs. So in this case, it's our 100 mLs, right? And our time. Now for this one, our time is already in minutes, so we don't have to do a conversion. So we have 30 minutes, right? And our drop factor is 10, right?
Yes.
So we take 100, we divide it by 30, and we multiply the whole thing times 10. And it should be, I'm thinking 33, but remember your drop factor always has to be a whole number because you can't give part of a drop.
So you would always round? Please tell me you would
For
always
drop
round.
factors, yes.
Okay. All right.
Always round for drop.
Because that's what gets me rounding. When I'm not supposed to round, I round anyway.
Okay. So everybody got 33?
Yeah.
Okay, that was enough for the math. Now we're moving it on. Okay. A nurse is working in a critical care unit where the focus is on primary care nursing. The nurse demonstrates understanding of primary care nursing when A, she asked the UAP to give a bed bath. B, she asked another nurse to call the physician for orders. C, she provides all aspects of nursing care for assigned clients. Or D, she instructs a nursing assistant to take the client's vital signs.
See?
C.
So B as in boy, did I hear?
No, C as in
C.
C as in cat, providing all aspects of nursing care, correct?
Yes.
Right, a nurse forgets to raise the railings of the bed of a client confused after taking pain medications. The client attempts to get out of bed and suffers a minor fall. The nurse asks a colleague who witnesses the fall not to mention it to anyone because the client only had minor bruises. What would be the appropriate action of the colleague? No other steps need to be taken because the client was not seriously injured.
B. B.
The client should
B as in
inform the
boy.
nurse that a full report of the incident needs to be made.
Yes, B.
Okay. C, the colleague should monitor the client closely for adverse effects of the fall. And D, the colleague should report the incident in a peer review of the nurse. So A is completely wrong, right? Even if the client wasn't injured, we still have to do an incident report. And why do we do incident reports?
To prevent further error.
Legal, legal.
Okay, legal concerns, because I mean, if something like, let's say the patient did suffer some kind of injury here and it went unnoticed, and then later the client comes back and places a lawsuit against the nurse for some reason. You have no paperwork here, you have no thing, nothing to back you or what you did on your side. The main reason, though, why we do incident reports is because for risk management. So if I was the janitor mopping the floor and I didn't put a wet sign up and somebody came along and fell, that would be negligent on my part as a janitor. So at some point in time, back in the day, a very long time ago, because we've had wet floor signs around for a long time, right? Somebody fell somewhere and a hospital got sued or something happened behind that. And when that happened, the risk management team came up with this plan to put up these wet floor signs so that other people wouldn't fall. So this is the whole purpose of the incident plan. It's not for the patient. It's not to help the patient. It's to protect you as an employee and also the hospital. And it's also to correct when we have risk factors in the hospital. It's to help us try to correct those risk factors and decrease them. And that's why incident reports are not charted in a client's record. You could chart that they fell, you could chart whatever you did in regards to that treatment, and you could chart any factual information about that injury or what happened to the patient, but you would not put that you did an incident report in the client's chart because that would be assumed that you did one if they fell. All right, what's the purpose of the evaluation in the nursing process? To direct future nursing interventions, to formulate a database of nursing diagnoses, to complete an initial plan of care, or to transfer medical orders to the plan of care.
B.
B. Is it B?
A. It's actually A.
A.
Okay. So in the evaluation process, what we're actually doing is we have set a goal or an outcome for the client, okay? And maybe that outcome is that the client will ambulate 25 feet by the end of the shift without independently, okay? So that's a specific and measurable goal, okay? So now we're evaluating that goal to see if it was met, partially met, or not met at all. And the reason why we do that is because maybe that goal is too elaborate for my client at this stage in the game. So maybe I have to simplify that goal a little bit to make it more achievable, because you want your client to be able to achieve those goals, okay? Maybe the client partially met the goal. Maybe they walked 10 feet, but then they started to get weak and they grabbed the rail and I had to run over and help them so they didn't fall, okay? So if that's the case, it's partially met. So now I have to consider, do I need to give my client more time, or is this a realistic goal for them to achieve? Or was it completely met? Now, if it was met, now I have to determine, was it too easy of a goal, or was it a good goal? The client met it, and now I can start advancing them towards a little bit more of a complex goal. All right, so that's the whole purpose, is we're going back. So when you write your care plan, in that evaluation part, this is what you're going to put. Goal met as evidenced by patient ambulating 25 feet throughout the hallway by the end of the shift without assistance. Goal partially met as evidenced by patient being able to ambulate 10 feet independently and then required immediate assistance. Okay, not met, patient unable to ambulate 25 feet, and then, as evidenced by, patient ambulated 5 feet and started to feel dizzy and weak and had to be assisted into a chair. So, what met it, what didn't meet it, and that's what goes in that evaluation stage. And then you're going to take that evaluation, go back and look at your outcomes and see how you need to tweak them now so that this patient can meet these goals. Can you guys see the whole question there?
Yeah.
Okay. The American Nurses Association recommends adherence to defined principles when delegating care to a UAP. According to these principles, who is responsible and accountable for the nursing practice?
A.
A, the registered nurse. Okay, good.
Mhm.
Not much explanation needed there, okay? You're the boss, you're the big dog, it all falls back on you. So, you know, this is why you want to have that good malpractice insurance, because even if you don't do something wrong, if you're teaching people and you're showing people stuff, they could still come back and say that, oh, so-and-so didn't tell me this, and that's why I screwed up. Either way, it falls under your license. So it's not that you have to prove to anybody that you did or didn't do it. You're just protecting yourself with that malpractice insurance. Right now, there's a cap on most doctors' malpractice insurance. So people are getting smart and lawyers are getting smart. So when they can't get what they want out of the doctor, they're coming to you. You're the next one that they're going at. So an elderly client was admitted to the hospital with a diagnosis of failure to thrive. The client has become constipated in spite of maintaining a high fluid intake and taking oral stool softeners. The client states she feels mortified to attempt a bowel movement on the commode at bedside where staff and other clients can hear. The nurse should respond by modifying which of the following resources?
Environment.
B.
Environment. B.
B. Environment.
Okay, good. Environment. Anybody not understand that? So this is all about the person's self-image, okay? And everybody can understand that, right? When you go in the bathroom, you want full privacy because you're concerned about a few things. It's not only the hearing, but the smell and other things that might be offensive to someone else. And some people can joke about this, but some people not so much, right? Some people even will become constipated, and this is a real concern, okay? Some people will become constipated because they'll withhold that bowel movement because they don't want somebody else to hear it or smell it. And then that causes them a problem in the long run. Okay, according to Maslow's hierarchy, a client who has a physiological need will benefit most by meeting those needs when the nurse provides one of the following: signs of affection and intimacy. Can you mute, please?
Bukola. Somebody's not muted. Bukola.
We good? Okay. According to Maslow's hierarchy, a client who has physiological needs will benefit most by meeting those needs when the nurse provides which of the following: A, signs of affection and intimacy; B, independence and spiritual care; C, social interaction and human caring; or D, foods and fluids.
B.
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 A.
Okay, so physiological needs are going to fall under those foods and fluids, right?
Yes.
Yep.
Okay, good. It's also how you're going to prioritize your needs. So when your care plan says which one of these has the highest priority for the nursing diagnosis, you rate your nursing diagnoses by high, medium, and low. So a high or priority nursing diagnosis is going to be something that's going to affect the wellness of that patient. So generally it's a life-threatening condition if it's considered high priority. Okay, if it's moderate priority, then it's not life-threatening, but it's important to what's happening with the patient at that time. And if it's low priority, then it's a nursing diagnosis that the patient has, but is not really correlated with what's going on with them at the moment. So when you think about ABCs and you prioritize according to ABCs, that's why we do it. Because if my patient is anaphylactic, all right, why do I want to establish an airway first? Because if they lose that airway, they can die in about 30 seconds. If they're bleeding, okay, if they're bleeding, then I have a few minutes, maybe 3-4 minutes, depending on how fast they're bleeding, before they'll actually bleed out and die. Okay. And if it's a circulation problem or something else, so what you have to think about is how much time do I have? Like if I had a arterial occlusion, that would be an emergent situation. Okay. If I have some other sort of occlusion, maybe in my vein, it might not be as predominant. Yes, I do have to fix it, but which one is going to cause the damage the most? So with an arterial occlusion in minutes, that area that's being perfused could go necrotic. And once it's necrotic, what happens? It's black, it's not coming back, okay? Necrotic tissue is not coming back. Once you kill it, it's dead, it's done. So this is why you have to think about priority nursing diagnosis is which one would I put first? What's most important? All right, so this client is coming to the cardiac rehab program, all right? This health promotion behavior is an example of which type of prevention. Now remember, with prevention, how does it work? Okay, primary is what?
Teaching. Teaching.
Okay, we're out in the public, we're teaching,
Teaching.
okay, about different things to the public, right?
Yes.
Okay, secondary is what?
Screenings.
Okay, those diagnostic screenings, seeing if someone has breast cancer or something like that. And how about tertiary?
Rehab.
Okay, rehab. They got that long-term problem, they're already sick, they got that long-term problem, and we're gonna help them manage it. So for those of you that said B, good job. Okay, client is scheduled for an abdominal hysterectomy. During the pre-op assessment, the client states, I'm very nervous and scared to have this surgery. What client outcome is priority here?
B.
B.
The anxiety.
Yeah,
Okay, good.
it's B.
Good. All right. We're not in a state yet for antibiotics, although we might be. And if we were going to give them, the surgeon probably already ordered them. There are some times when they might give us some antibiotics in advance of surgery. Okay. Pre-op education. Hopefully this has already been done, right? And if they're have anxiety, your pre-op education may or may not help them, because they may have already gotten the education and that might be what's causing them the anxiety. Okay, and then we're preparing the client for surgery, but we can't prepare them if their anxiety is at a level where it's not controllable. If that were the case, at that point, you may have to call the surgeon, because it might not be an opportune time for them to actually have this surgery. And sometimes clients do, freak out at the last minute. What are specific, measurable, and realistic statements of goal attainment?
D.
The outcome criteria. Good. Okay, so these are the things that your goals need to have. When you put these goals into a statement on your care plan, it has to be measurable. How are we going to measure it? Okay, so when you put down there that your patient is going to have weight loss, or that your patient is going to increase fluids, how are we going to measure that? When you say that they're going to show signs of improved breathing, how are we going to measure that? Signs of improved level of consciousness, how are we going to measure that? And when are we going to have it done? So is it a realistic time frame? Is it a realistic goal? A treatment based on a nurse's clinical judgment and knowledge to enhance the client's outcome is called what? I hear a couple of people, and I would say,
Intervention?
okay, say the answer now, guys. Get the answer now. Don't wait to hear it from somebody else. If you're wrong, be wrong now. Don't be wrong on the test. If you don't understand something, stop me and let's talk about it. Okay? If I don't know the answer, we'll find it together. I don't know the answer to everything, just some things. All right, a treatment
Is it
based on a nurse's, I'm sorry?
Go ahead. I'm sorry. Nothing.
It's an intervention, Samika.
Intervention. Intervention.
Intervention.
Yes.
Intervention.
Okay, it's based on your clinical judgment and knowledge to enhance the client outcome. So what might be an example of a nursing intervention?
To prevent a client from falling.
What? Where is it?
Ambulating a client.
Hourly checks.
Okay, so I hear some things. So nursing interventions are those things that you will find on a nursing care plan. So let's say your patient is at increased risk for impaired skin integrity due to them being immobile. So ambulating that client, as someone said, would be a nursing intervention. Let's say that your client were dehydrated and you were going to encourage fluids. So that encouragement of fluids or putting having them drink so many fluids every hour, that's going to be that intervention as a nurse that you can do, because you know that increasing their fluids by mouth, if you can, is something that you want to do to try to prevent any further dehydration, right? So you want to think about what is something that I could do on my own that would be on a nursing plan of care that would not require a physician's order. When a nurse assists a post-op client to a chair, which type of nursing intervention does this represent?
Surveillance.
Psychomotor.
Psychomotor.
Okay, psychomotor, yes.
Psychomotor.
We're using those skills to move, okay?
Okay.
A nurse encourages a client to maintain an ideal body weight. This health promotion behavior is an example of which type of
Primary.
Primary.
primary, good. Of the following types of nursing diagnoses, which one is validated by the presence of major defining characteristics?
Actual nursing diagnosis.
Okay, good. Actual nursing diagnoses. According to Maslow's hierarchy of needs, which nursing diagnosis has the lowest priority for a client admitted to intensive care unit with the diagnosis of congestive heart failure? Now remember, we talked about this, and I said the highest risk priority are what?
Airway.
Those that are life-threatening.
So it's B.
Okay, moderate are those that are what?
It's D. Risk for body image.
Risk for body image
Okay,
disturbance.
ones that have the lowest, or the least connection to what's going on at the moment.
The body image.
Risk for body image disturbance.
Okay, good. That's correct. Okay, in the nursing diagnosis, disturbed self-esteem related to the presence of a large scar over the left side of the face. What part of the nursing diagnosis is presence of a large scar over the left side of the face? So which part of the statement is this?
A.
A, etiology?
A.
Yeah.
Okay, so etiology means the cause of this thing. Okay, that's what etiology is.
Defining characteristics.
I think it's B, like boy.
It's A.
It's not
Okay,
A.
so the nursing diagnosis is disturbed self-esteem related to the presence of a large scar over the left side. Now, disturbed self-esteem is the problem.
It's the problem.
Okay, presence of the large scar is the cause of that problem, right? Because that large scar is what's causing them to have a disturbed self-esteem, correct?
Yes.
Yes.
Okay.
See. So what's the answer?
What's the answer?
Yeah.
A is the answer.
Yeah, A is the answer.
A is the answer because our problem is disturbed self-esteem, and the cause of that problem is this large scar. If I didn't have a large scar, I wouldn't have an esteem problem, right?
Exactly.
Okay.
Exactly.
Which information provides the nurse with accuracy when developing a nursing diagnosis?
Yeah. Oh, yeah.
A.
A.
A set of clinical cues.
Oh, baby.
A set of clinical.
A set of clinical cues.
So, correct.
Oh,
It's a set of clinical cues.
I'm back.
Oh, God.
I'm
I
back.
just want to make sure I don't have somebody in the waiting room.
What's going on? What's going on?
Oh, no. Oh, no. He is.
Uh-oh.
I'm back. I'm back.
Is that Michael?
You know it is.
I just came back.
I know. You can tell.
Hi, Miss Lou.
Hi. How are you?
I'm fine.
Good.
Are you?
I know you've done a lot behind me. Wow.
Oh, God.
You miss a lot.
Wow.
Hello, Miss O.
We
Hi.
already
How you doing?
Hi, Eddie.
Hi, how you guys doing?
Good,
Eddie.
Okay, what is the purpose of establishing a nursing diagnosis?
C.
No.
The functional is A.
A.
Hey.
Yes, ma'am. A, functional. That's correct.
A.
Describe a functional health problem. Okay? It's not to collaborate with the physician. Because again, you know, as nurses, what are we treating? We're treating those things that are interfering with that patient's daily life, because that's the things that are bothering them, right? They could be eating the wrong diet. They could be smoking. They could be going buck wild. Okay? But until the problem that they have affects that buck wildness, it's not a problem. Right? I could be drinking out of control, eating out of control, getting with every girl or guy on the planet out of control. But until that diabetes interrupts my sexual activity, or until that food causes me where I can't breathe well because I've got now so much sodium and fluid retained, I'm not going to come and complain, right?
Right.
I'm going to just keep on doing it. And that's why people get so sick, and, you know, we have to bring them back to a normal state. And these care plans won't work unless they agree to it. A lot of times these patients have been so non-compliant for years that, you know, we have to take these care plans in little steps to get them to really achievable goals. We can't just create this elaborate goal for this patient to try to meet to bring everything back in check. We're going to have to do that in little steps, and they're going to have to agree to those little steps, or they're not going to get better with that care plan.
So was that A?
A. Describe a functional health problem.
Thank
The
you.
purpose of the nursing diagnosis is to describe a functional health problem. The primary purpose of obtaining a nursing history is what?
D.
Assist the
Identify
physician to
actual.
establish a medical diagnosis.
Identify
D.
actual.
It's D. Identify the actual and potential nursing diagnosis.
Okay, Michael.
Okay.
Michael, don't be a follower.
Should I tell you the page in the book?
No, you don't need to.
Okay.
Okay. I know it's a preview question.
I didn't even finish reading the question.
Yes.
So yeah, Michael, when we get done with the question, you could actually tell me the page numbers and I can add them on here.
Yes.
Okay,
Yeah,
okay.
that'd be great too.
Okay.
All right, so assist the physician to establish a medical diagnosis. B, minimize the time required to establish a nursing diagnosis.
Not showing.
C, it's not showing?
No.
I see it.
I see it.
I see
I
it.
see it. It's showing.
Okay.
My screen is still showing the previous question.
We're on the old question. I
She's
didn't.
still on the
since
question.
Some
Okay,
people
I
didn't
thought she-
read it. I'm reading it for the ones who didn't get a chance to read the whole question.
Oh,
Thank
okay.
you.
All right.
Thank you.
Focus
Thank
on
you.
objective physical data specific to the client. And D, identify actual and potential nursing diagnoses. So yeah, we want to get that nursing history because what we're really concerned with right now is our actual nursing diagnoses, because those are probably going to have the highest priority. But we still have to think about other potential nursing diagnoses, because let's say we're admitting our patient for a cardiac issue. Okay, so one of the things that could happen to them if they had a cardiac arrhythmia or something is syncope, and that could put them at risk for a fall, right? So we have to think about both the actual and the potential nursing diagnoses, especially when they're in a hospital, because if they are at risk for some of these other things, we would want to address that because we don't want our patient to get worse while they're in our care. So we have to address both. And that's what that nursing history is going to help us do, recognize and address both. All right, during the interview component of the health assessment, the nurse conveys to the client that the information is important by 1, nodding frequently during the interview, 2, sitting at eye level with the client,
B.
3, standing next to the client while interviewing, or 4, limiting questions to those with yes or no answers. So if I was doing this question on the exam and I wasn't sure how to answer this, okay, I want to take out the stuff that I know is probably not true. So if I limit questions to yes or no answers, I'm limiting 1, my therapeutic interaction with the client, and 2, my ability to achieve the maximum amount of info that I could get out of this client that's going to help me care for them. If I stand next to the client while I'm interviewing them, certain cultures may look at that as a degrading, or the fact that I'm looking down on them, or as a disrespectful type of attitude from me. I would want to sit at eye level with the client, okay? Even though some clients may not look you in the eye, it still shows a level of respect. So you definitely want to be at the eye level, even when you're feeding clients and doing care with them. You want to be as close to that eye level as you can. And we actually have that benefit now in the hospital because our beds go up and down so that we can bring the client sometimes up to our level. And then nodding frequently through the interview, what does that mean? The client may perceive that as one thing or another. If you're nodding, they may not perceive that at all as what you interpreted.
Or like you're rushing.
You're not listening.
Right. So which one do you think makes the most sense?
B.
It's B.
Sitting at eye level.
It's B, but I'm Muslim, so I don't know.
It's B.
It's B,
Okay.
but
So if you're Muslim, what would your take be on this, Michael? Would you want me to sit at the eye level with you, but just not look you in the eye?
I don't know, but by right, it should be like sitting with a client, but the highest level that's what like confusing me a little bit. But it's B.
So the height level is confusing you because of your culture. So that's why I'm asking you, what would be culturally acceptable to your population? And would this be variable on the fact if I were a woman and you were a man, or vice versa?
Yeah, maybe I would just get the noise to find the same sex partner. Like maybe I'm a male, maybe I would like to for a female, for a male nurse to do the assessment.
Miss Sue, let me help Michael here with our culture. A could have been the appropriate answer for respect, because in our own culture, when you look at somebody in the eye level, they think you disrespecting. That's why, but this is the nursing aspect, that sitting at the eye level is the correct answer. But if it was in our own culture, when you keep nodding, that shows respect, even though you don't look at eye contact. That's why Michael is trying to say with the Muslim culture.
So, you know, that's good for me to know, because as a supervisor, when I'm having conversations with certain employees, okay, actually, I do this with all my employees, because for me, when I look at you in the eye, and this is an American custom, but to me, when I look at you in the eye and I talk to you and you look back at me, I'm able to discern whether or not you're being truthful with me.
True, yes.
Sometimes when I look at certain people from certain cultures, they don't want to look at me in the eyes. And
that's a sign of respect.
That's a
as
sign
if
of
they're
respect.
being deceiving, but really it's respect that's happening here.
We don't look at them right in your eye, elders.
Miss Luz, if you look directly into my eyes, I'm gonna tell you that
I'm
why are you
elderly?
staring at me? I'm gonna ask you that why are you staring at me?
It's sign of disrespect, folks.
Okay,
Hi, Eddie, sign of disrespect.
Yeah, it's not, when you look somebody in their eyes directly, it's like you're disrespecting them.
Yeah, so that's it. That's what I'm saying. Like, Miss Luz, we have to find out about this question. That question.
No, this question is correct according to the American
question is
culture.
correct.
Yeah,
because
it's
what they
correct, but it's
do-
not good for me. I don't want that question in the exam because I will pick the wrong one.
You're going to get it wrong?
Yeah,
Well, you shouldn't get it wrong now.
because
not gonna
culture
pick-
too is culture too. It should be part of the nursing process too. You know, everything goes along with culture.
Not going to pick what's appropriate culturally for you in these situations, okay? What you're going to pick is what the NCLEX lady is telling you to pick.
That's right.
Hey,
Exactly.
Okay, because you want to get the answer right, not wrong. Okay.
I know that's right.
Mike,
you know, we're doing this so that when we come across this question, we'll remember.
we're not listening. Listen to the boss, Mike. The boss already said it.
Okay, move on, Miss Sue.
Yes,
powerful.
please,
move on.
please.
Please.
God.
You want me
the
to go
home
out?
care nurse is preparing
Yes,
to
Michael,
perform
bye-bye.
a nursing history.
We
Oh,
can't
are
see
you-
your
We
screen.
can't see your
I had to
screen
stop
anymore.
the share because it wouldn't move forward, and now I forgot to put
Wow.
it back up. So let's go back to it.
Michael, don't say
Thank
nothing.
you.
Oh, Miss Luz,
Yes,
they say I shouldn't say anything.
Unless the answer.
you don't have to worry. I'm in charge, Michael.
Okay, thank you.
Bye, Michael.
Okay, Michael. The home care nurse is preparing to perform a nursing history on a newly assigned adult client with a venous stasis ulcer. Which statement by the nurse is most accurate? A, when I perform the nursing history, I will need to ask your family to leave the room. Is that a true or a false statement?
It's a false statement.
Okay, so really what you would want to do is you would want to ask the client, is it okay if I question you in front of the family?
Yes.
Yes.
I would like to perform a nursing history. This allows the healthcare team to get to know you better. That's a reasonable statement, right?
It's a true statement.
Okay. I will perform a physical assessment while attaining the nursing history.
No, you have to do one before.
Okay. I will leave a form with you to complete the nursing history information I need.
No, you have to
B
educate
is
it.
the correct answer.
B,
Yeah.
as in
Yeah.
boy.
Yes.
As in boy.
Okay, great. Great job. When the nurse inspects a post-op incision for infection, which type of assessment is being performed?
That's focus.
A, complete, B, focused, C, general, or D, time-lapsed?
B, focus.
Okay, good. Anybody questions with that?
No.
Miss Luz, my question is like this. What is the difference between the focus and the time lapse? Because sometimes it's a little bit confusing.
Timeline is reassessing.
Like nursing homes and long-term care facilities, you would do a time lapse
Hold on one
to
second,
reassess where the patient is.
Yeah, correct.
So the time lapse is not is it should be part of the focus, right? But just like you reassessing, right?
A lot of the times over a period of time that pass by, like like patients who are in nursing homes, they're there for a while, I think. So I think the nurses go back maybe like, I don't know,
With nurse, we don't think.
I think a lot of the questions that came on the
that true,
Time
Ms.
lapse,
Loesch?
the right word
What
you
did
said.
he just
You
say?
reassess. You reassess.
We don't
What did he?
we
What
don't
did he
use
just
the
say?
word I think as a nurse. All right?
We
The
do
time
think
lapse
as nurses.
a lot of the questions that came with the time lapse had to do with pain management, where you
Oh
would
yeah, pain
you would
management. So.
administer the medication, then check them back in like a half hour to 45 minutes. That I mean, that's on the NCLEX when I was doing those tests. That's what a lot of those questions. That was the answer.
Okay.
So a time-lapse assessment is one that is scheduled to compare a patient's current status to baseline data obtained earlier.
Yes.
Right.
So
I thought I saw
someone had surgery, okay? So after the surgery, you're going to do within 15 minutes an assessment. And then 30 minutes, you're going to do another assessment. And then in an hour, you're going to do another assessment. And then in 4 hours, you're going to do another assessment. So these are time out so that you can compare the statuses. And they'll be timed based on whatever the procedure is. So sometimes, like right after the procedure, you're checking the patient for every 15 minutes. And then after the first hour, it goes to every hour maybe. And then after that, it might go to every 4 hours. Okay, so it's a timed out or layered out assessment as opposed to focused, which is where you're just thinking about one problem. So your patient came in and maybe they had an MI. So your focus is on that MI. It's all about that cardiac. Or your patient has a cold. So you're focusing on things about that cold. So if your patient had a cold, what would you be looking at? Lung sounds, their temperature, maybe any nasal drainage. You don't care what their complete health history is for the last 20 years. You're only there to deal with them about that cold. So this would be something like you would see in a doctor's office or in an urgent care or in an ER, because they're coming in and you're just focused in on what that one general complaint is right now. That makes sense?
Yes.
Yes. But I think we had a question. I saw a question where it said the patient was in a long-term care facility or something like that, and the patient's roommate told the patient that the nurse is probably coming back to check to do an assessment. And I think the answer was time lapse or something.
Yes, I saw it on the print.
Yeah. Yes. Okay. I thought, all right. I knew I wasn't tripping. All right. Yeah. So that would be like a time lapse, right? Assessment.
I have to see the whole question because you guys only give me bits and pieces of questions. It's hard for me to tell you how the question would be answered. But say it to me again, as much of it as you can remember.
It just, if the book was talking about what different settings you would do specific assessments in, like acute care, long-term care. It was just saying like what was the common assessment that the nurses would do in those settings, in those different settings.
Okay. So, I mean, time lapse is when you're going back, like maybe you gave patient Tylenol and they had a temp. So after you give that Tylenol, you're going to go back after a certain period of time to see if it's effective, right? So you could definitely use that in a nursing home setting. How about if you put an IV in someone? Would you do time-lapsed assessments on them?
Yes.
Yes.
Absolutely. Every hour you need to go and check that flow rate and everything of what's going on with that IV, right?
Right.
Or like you give a PRN medication, you have to go back and check the effectiveness of that pain medication.
Please mute.
So again, these, different ones could be used in a variety of settings depending on what's going on. Let's say you were doing a general assessment. When would you do that? Well, you might do that if, let's say, a driver was going in to get a CDL license and they had to get a document to say that they're in good physical health. You might do a general assessment in that case to say that they're in good general health to get this CDL license so they can drive a truck. Your kids go and they get a generalized physical assessment sometimes it's complete, but a lot of times when they're playing sports, the physician's just gonna, you know, do a generalized assessment. He's not really gonna do a complete assessment of this kid. And then he's gonna sign off on the sports certificate so that the kid can play sports, right?
Yes.
Now, if someone were going, like, say, for a heart transplant or a kidney transplant or something along that lines, you're going to want to do a really complete physical assessment on that person. You're going to want to know all the aspects of their care because you're getting ready to do a transplant on them. So you want to know any dynamic that could really impair or, you know, be associated with that might affect this transplant. So you want a real complete focus there on the entire system. Okay, which of the following are examples of objective data?
B, C,
B, C,
A,
B, C,
no,
E.
B, C, and E.
Oh, objective, right.
B, C, and E.
Correct.
B, C, yeah, and E.
Okay, good. So A, the client is talking, okay? Whenever the client is talking and you can't see it, the combination of those two things, okay? You can't see his pain, really, and he's talking about it, so that makes it subjective. The client feels nauseous. You can't see that nauseousness. They can only tell you about it, so again, that's subjective. So you can view and analyze lab results. You can hear breath sounds, and you can actually not see the sounds, but you can see the breathing itself, right? The respirations.
Fall of the chest.
Huh?
Well, Miss Lewis, when I was doing my PM program, they say it can be either subjective or objective.
Well, the pain itself could not be objective. What could be objective would be the face on the look on the patient's face, the grimacing or the crying. That is objective. The guarding or the grabbing of the site or holding of the site, that itself is objective. But the pain itself, you can't see. Tell me what pain you've ever seen.
Because they say any objective data is something that we can measure. And if we ask the client the pain level and the client say, oh, 8 or stuff, so we can measure like the level of pain is 8 or stuff. That's what I understand.
You can put as subjective data that the client described his pain as a level of 8. And you could put patient presented as a level of 8 on the Bond-Waker scale by his facial thing. But you can't see the pain.
Okay. Okay.
You can see the signs and symptoms of the pain.
What's up?
A client asked the nurse, "What do you think of my physician?" The nurse states that the physician doesn't seem to care about clients or how well their symptoms are managed. As a result, the client switches to another physician. The physician may have grounds to sue the nurse for what?
Slender.
Okay, slander. Does everybody understand these different concepts?
Yes.
Slander. Libel is the reading.
Gotta finish the whole sentence.
Everybody's good with all these definitions?
Yes.
Okay.
You can finish them.
You want me to go through them?
Yes, you can go through it.
Yeah,
okay.
That's fine too.
Slander? I think it's slander.
Slander.
1 second. Okay, slander is oral defamation of the character. Okay, so when I slander someone, I'm talking about them. All right, libel is when I write something, written defamation of character. Okay? So slander, I'm talking. Libel, I'm writing. Okay, malpractice. What's that? Who knows?
Leave a sponge in.
Wrongdoing.
The act of negligence as applied to a profession. Okay, so a physician, a nurse, or a dentist. Okay, you do something that you shouldn't have done, or you do it away. It could even expand to this point. Let's say that I don't know anything about IV infusions, and my nurse manager gave me an IV infusion to go and do, and I took the assignment because I wanted the money. And when I got there, I didn't know I was supposed to do something, and I did it, and ultimately the patient died. All right, like let's say, here's a perfect example. When I used to do IV infusions, one thing that physicians would order all the time was cephalosporins for people allergic to penicillin. Now, what have you always typically been taught as a nurse? You got to watch them, right? Because if they have an allergy to one, they might have an allergy to another. Right. So what will they do? They'll prescribe the cephalosporin, and then they send epinephrine to the patient's home just in case they go into anaphylaxis when they take the medication. Now, if you're not familiar with that practice and familiar to make sure that that epinephrine is in the house, you might go ahead and administer that cephalosporin, and now the patient taking it, they go into anaphylactic shock, and you have nothing there to help the patient. That could be determined malpractice because you were negligent in making sure that the things you needed in the home to treat this patient were there. And then invasion of privacy would be like, let's say I had nursing students on the floor and I didn't get my patient's permission for the nursing student to come in and observe a procedure. I could be sued for invasion of privacy there. I have to get my patient's permission before I can let them participate in certain studies, before I can let certain people watch them or read their book or go into their medical records.
Miss Sue, I just had a question about the malpractice. So I know it's like doing something, but if you didn't do something that you should have done, would that be considered malpractice?
Yes.
That's not neglect.
Okay.
Well, it is neglect, but you could be sued for malpractice.
Gotcha. I was thinking like, you know, like say if a patient comes in and complains of like chest pain, you know, and you didn't, I don't know, do an EKG or something like that, and the patient dies or something, you know, I don't know. I was thinking like on that side too.
Well, it would be more along the lines like, let's say you didn't call 911 or you didn't apply standard care. If you didn't apply the standard nursing care that you're expected to provide, or if you were doing something not within your scope of practice, or if you were doing something within your scope of practice, but you were negligent, you could be sued for malpractice. You also could be sued for malpractice based on what somebody else did, and they may be pulling you into the suit. Eventually, they would have to prove that you were negligent in your job title for you to be held liable.
Right.
Intentional or unintentional?
It doesn't matter whether it's intentional or not. Okay?
Well, to say, because sometimes it's not intentional.
It doesn't matter whether it's intentional or not, okay? Let's say you were giving someone insulin. Let's talk, how many of you know Nurse Jackie?
Nurse Jackie?
Yep.
Okay,
No.
so let's say you were giving somebody insulin and you were supposed to give them 0.4 units, but you read it wrong or you did the math wrong and you gave them 40 units.
Oh God, yes.
Is that intentional?
No.
No.
Unintentional.
Could you still be sued for malpractice?
Yep.
Yeah.
Absolutely. You didn't intentionally do it, but you still screwed up. You have a license. You screw up, you could be sued. That's why we are so adamant about learning everything and not learning just for the exam, because you have to protect that license. It's so hard to get it. You work so hard for it. You want to keep it. And you also don't want to do your patient more harm than good. The nurse ascertains that the client is showing signs and symptoms of dehydration due to nausea and vomiting. The nurse makes the client NPO and calls the physician. The nursing action of making the client NPO demonstrates which process?
See?
General systems theory process, problem-solving process, decision-making process, or information-making process theory. So yes, it is decision-making process for those of you that said it. So let's talk about this for a second.
Yes.
All right, so your general systems theory, okay, this theory is used to describe how we break whole things into different parts and then how those parts work together in a system, okay? And it's generally applied to things like molecules in chemistry, different cultures in sociology, organs in anatomy, and health in nursing. All right, so it's a set of interacting elements that contribute to the overall goal of that particular system. The whole system is always greater than the parts of that system. All right, so boundaries will separate the systems from each other and from their environments, and open systems maintain a balance through feedback. So really, when we're talking about things like, let's say we were talking about cultures in sociology, we're talking about how that culture functioned overall as a whole, not just the little pieces of it individually, but how do all those pieces work together to make it dynamic. Come on, computer. So for the problem solving process, let's talk about that a little bit.
Yeah.
We use a problem-solving approach. It helps us use a three-step process: practice questions, evidence, translation, to try to resolve things that are going on. So we identify the process, and then we use different steps to try to figure out what the actual problem is, you know, do a study and figure out how we can get to the bottom of that process. The nursing process is similar to that, okay? It's a problem-solving process, and we use a nursing process to do it. We assess, we diagnose, we plan, we implement. So that's just kind of an example of one type of way that we do problem-solving or use the problem-solving process. For decision-making process, so in order to make a decision, we have to have some sort of approach, right?
Yeah.
To guide us along the way of that decision making. So again, we use the nursing process or some sort of problem solving process, to help guide us through making these decisions. Maybe sometimes we use an ethical framework, okay? So that framework keeps us in line, and it helps us determine like what the problem is, analyzing data, putting 2 and 2 together so that we have some sort of systematic way of coming to a decision. We're not just making a decision because this is the way we think that it should go. And for information processing, we're using information that we've gathered, okay, data, and we're looking at that different data, and we can come up to a conclusion or an answer based on the information that we've collected and that we've gathered. So that's going to help us come to a logical conclusion. Like, let's say we looked at the lab values. You know, somebody's got signs and symptoms of something going on. We look and analyze the data from their labs, and we're able to process that information to make a decision. Does that make sense?
Yes.
Yes.
All right, the nurse prepares a narcotic pain medication and gets distracted before administering the medication. Later, the medication is administered to the wrong purpose. What type of law addresses this?
Practice Act.
D.
Is it B?
I'm thinking B. Civil law.
Okay, it is B, civil law and negligence. Okay, because civil laws, let's go to the rationale here. I'll pull it up for you guys. Civil laws or torts are when unintentional wrongs have occurred against a person or a group. So you made a medication error, but it wasn't on purpose. Okay?
Oh,
if
okay.
I purposely took that medication and took it myself, or purposely took it and gave it to somebody else, or if I purposely gave that person the wrong medication, then it would be different. But this is when negligence is when the unintentional harm occurs, when the nurse fails to act in a responsible manner. And administering an incorrect dose of narcotic would be under civil law and considered negligence because it could cause the client harm. Vicarious liability is when the liability is shared by another person. So this could sometimes happen, although I think you would be more responsible than the other person. But an example of this might be if someone pulled the wrong medication and then you gave it, because you already know you're not supposed to give medication that someone else pulls, right?
Yeah.
Mm-hmm.
But really that could be a type of vicarious liability if, and this might happen if somebody's trying to divert narcotics, where a nurse would be, oh, can you give this medication for me? I already pulled it. And you're like, okay, trying to be nice, right? You don't even look at what the medication is, and you administer it, and you think you gave the person a narcotic. Meanwhile, the nurse that was supposed to pull the narcotic actually took the narcotic and gave you something in place of it.
SIBO.
So the Nurse Practice Act is a example of administrative law. It's an administrative body that determines rules and regulations for the nurse practice in every state. And the Controlled Substance Act in 1970 controls manufacture and distributions of medications that consider to have a potential for abuse. So when we deal with the Controlled Substance Act, that's usually dealing in a capacity where, you know, like when you're dealing narcotics on the floor, okay? Let's say your narcotic count is off. You need 2 nurses to come now and sign, right? Or when you're doing a 2-person count, you have 2 people counting to make sure that your narcotics are always correct. Or when you're pulling certain narcotics on the floor, you have another nurse come and sign so that this way there's 2 people there to witness. or when you have to waste a narcotic, you have a second nurse there so that there's proof that you actually wasted it and didn't pocket it. All right, the nurse is preparing to send a client to the radiation department for a scheduled radiation therapy. Which action will the nurse take to determine the correct identification of the client?
B.
I would say.
Okay, ask the client his name and repeat his name to him. In my population, the client might give you his wrong name and then repeat his name to him. So when you repeat the name back to them, they'll actually say, yeah, that's who I am, even though it's not them. Ask the client's name and date of birth and compare the response against the identifier on the order requisition. Well, this would do a couple of things, right? Number one, it would tell you the client's level of consciousness if everything matches, or two, if something else is going on. Also, it's going to help you identify if everything matches. 3, check the client's armband against the identification records on the chart. I mean, it can be a method, but I wouldn't use it solely. And then 4, because there have been incidences where clients have been misidentified or the wrong bracelet has been put on their arm.
Yeah.
And then 4, check the doctor's order on the client's chart and determine whether he or she is to receive any medications before the treatment. So that's not going to help you correctly identify. So good. For those of you that said B, that was the only correct identifier. So the Joint Commission requires 2 points of identification. And sometimes even 2 points are not good enough, okay? I've seen medication errors on 2 points. For a client with an armband, it's recommended that the nurse check the armband against the chart, against the name and date of birth on the client's armband. Asking the client for just his name only, one identifier, checking the armband is not sufficient in the environment because the client should participate in the identification process. Checking the doctor's order on the chart should have been done to verify the correct order, not the client's identity.
What if the client is non-verbal?
What if they're not?
Non-verbal.
So, okay, so this is where I work at. Okay, we have a lot of clients that are nonverbal or won't specifically give you their name if you ask them their name, all right? You ask them their name, they might tell you that it's sunny on a windy day. And that would be their answer, okay? What's your name? Oh, it's sunny out today, ain't it? Okay, so in this case, our clients are required to have a photo ID. So there's photo IDs there in the unit. We also have picture IDs on what we call a photo board and on the medication administration records themselves. Staff is also supposed to be with the client to identify the client. Here's the problem that you have, especially when you're dealing with like psychiatric patients or patients that can't talk for themselves. You put these photos on these boards, but if someone doesn't update the photos all the time, they're really not as great as what they should be. Because, on psychotropic drugs, clients can have big weight gains, big weight losses, and their appearance can dramatically change from one day to the next. So I've seen situations where these clients came to the door, they were identified as being a certain person by the staff. The nurse asked the staff twice who the patient was, and they went by the staff's identification. The client wasn't the client that the staff said it was, and the picture kind of looked like the client, but not really. So the nurse gave the medication not once, but on 2 occasions to the wrong person through these identification measures. So you really need to make sure that you have something in place to identify these nonverbal people, because it can happen very easily for them to get the wrong medication. So generally, hospitals will have some other sort of plan in place, but it's not always foolproof. Okay, a client complains of weakness following administration of insulin. The nurse decides to assess the client's blood sugar and prepare a snack in case the blood sugar is low. What action has the nurse implemented?
Clinical reasoning.
Okay, good. Clinical reasoning. Anybody not understand that? Unjustified retention or prevention of movement of another person without proper consent can constitute which of the following terms?
False imprisonment.
False imprisonment. So if you hold me against my will, okay, false imprisonment. And this can happen if you restrain somebody, okay, and you're not following a certain regimen. An unexpected occurrence involving death or serious physical or psychological injury or the risk thereof best describes which of the following legal terms?
B. Sentinel event.
Okay, a sentinel event. So whenever there's a death involved there, it's going to be called a sentinel event. And if you think about it as a sentimental event, okay, maybe that will help you, because when someone dies, it's always going to be a sentimental component to it, right? Unless it's your ex. Oh, I mean, no, I didn't mean that. Okay. Client is suing a nurse for malpractice. What is the term for the person that brings the suit?
A.
A.
A, the plaintiff.
Plaintiff.
The plaintiff.
Plantain.
Plantain is suing you.
You know, Michael.
Which of the following is the most frequent reason for revocation or suspension of a nurse's license?
C. C.
C.
D.
No way.
D.
Alcohol or drug abuse. Okay.
C.
Yes, alcohol or drug abuse. Most frequent reason. Okay, because most nurses are ethical, but we are not, we're human.
Right.
Drinkers.
Okay. Sometimes in COVID situations, we
You need
become
to
big
drink.
alcoholics.
Ms. Lewis,
Okay?
I don't like this question.
Those
Why?
drinkers.
Why don't you like it?
What are the criminal acts?
Well, there are some nurses that have committed criminal acts. Can you name one?
Stealing medication.
How about the nurse that went around and injected people so that they would die? He was from New Jersey, by the way. He was giving injections to people and they were dying from it. That's a criminal act. If you're
Why was she
personally
doing
going
that?
around, I forget why he was doing it, but
I think it was in Somerset Hospital.
yeah, I don't know why he was doing it, but he was. But that would be an example of a criminal act. Most nurses are ethical. Now, you could be ethical and still have an alcohol or drug abuse problem.
Yeah.
All right, not all drug addicts are unethical.
But it's a
Sometimes
most
the
frequent
drugs make them
reason.
go that route, but not everybody is unethical because they're a drug addict. Some people have the money and, you know, they're just harming themselves. They're not hurting anybody else. And that's why we consider alcohol and drug abuse a disease. It is a disease. It affects the mind, and it affects actually the pleasure sense of the mind. And it can corrupt the mind to make you think that you need something that you really don't need. Sometimes nurses, you know, get legitimate injuries at work and stuff, and that's really what starts that whole ball rolling downhill. They get injured at work because of a back injury or something. They end up on narcotics and they get addicted to them just like anybody else. All right, a lawsuit is brought against a nurse for malpractice. The client fell and suffered a skull fracture, resulting in a longer hospital stay and a need for rehab. What description of the client represent as a proof of malpractice?
Damages. Damages.
Okay, damages. Damages are the proof. What is the legal source of rules of conduct for nurses?
Nurse Practice Act. D.
D.
Yeah, D.
Okay, Nurse Practice Act. So your Nurse Practice Act for each state is what's going to set down your rules of conduct. Try to read the one for New Jersey, by the way. A nurse states to the client that she will keep her free of pain. However, her family wishes to try a treatment to prolong her life that may necessitate withholding pain medication. This factor will cause an ethical dilemma for the nurse in relation to which ethical principle?
Fidelity. Fidelity.
Okay, fidelity.
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 Fidelity. My tone is heavy, Miss Blue.
The tone is heavy.
Mm-hmm.
You know what fidelity is, Michael?
Fidelity.
That means keeping promises, commitments made to others.
Fidelity.
All right. So infidelity, we all know what that is, right?
Yes.
Yes.
So that one should be an easy one to remember. Veracity, what is that?
Telling the truth.
Okay. Telling the truth. How about justice?
Fight for all. Talk for all.
Okay. Yes. To distribute the benefits, risks, and costs of nursing care justly among all.
Yeah, justly. Mm-hmm.
Oh, I got it with the turkey.
And autonomy.
It looks good.
Decision.
Okay, giving the information and support to patients and their families to help them make a decision that's right for themselves.
Mm-hmm.
Okay. A nurse states when the client, oh, I'm sorry, I don't know what I was reading. When the nurse inserts an ordinary urinary catheter into the client's urethra after the client has refused the procedure, the client suffers an injury. The client may sue the nurse for which type of tort?
Battery.
A.
Battery.
Okay, battery. So let's just talk about these for a minute.
Hey,
Miss Lou, what's been updated and dereliction of duty?
What's what?
The D and the dereliction of duty. What does that mean?
All right, I'm going to find something on that. Just give me a second because we're going to go through all these, okay? All right, so sometimes, excuse me for 1 second. thank you. All right. I'm just saying, because, you know, they start with that crap on the weekend, and then her thing will be she reported it to me, and I don't want to hear about it. She's on duty. She's responsible, not Suey. I'm not on duty. All right, guys. Sorry, back to the question at hand. All right, so battery. So how do I remember this, okay? Battery is actually assault. When I actually hit somebody. Wow, my life. Okay. Battery is when I'm about to whip somebody's butt and I do it. Okay? That's actual battery. Assault is the threat or the attempt, but you don't actually make contact. Okay? You're attempting to assault someone, but you don't actually make that contact. And then invasion of privacy we talked about earlier. Now, let me see this dereliction of duty, what this entails. And that's actually not in your book, it doesn't look like.
But I suggest like say failure to perform failure through negligence to perform
From a
bigger.
duty?
Yeah.
I'm going to give it to you right now. Just give me 1 second. All right. Dereliction of duty is the state of having been abandoned and becoming dilapidated. So, in other words, I left somebody, I abandoned them, and as a result of that, they became incapacitated in a way where they could not perform.
Give me an example, please. Like leaving somebody in the bed.
Yeah, like negligence, something like that.
Or not turning repositioning
A
somebody?
deliberate or accidental failure to do what you should as part of your job. So I was supposed to give somebody an IV medication at 10 a.m. and I didn't. And as a result, they ended up with a worse infection, sepsis, or something like that because I either forgot or deliberately didn't give it to them.
Oh, okay. It's the same like not returning a patient every 2 hours and they have a bed sore?
Exactly.
Yes.
Okay.
Miss Sue, can you let me in? I'm trying to log on through my computer.
Okay.
Thank you.
I don't have anybody in the waiting room.
Please wait for a host. Look.
Huh?
You see it? It's saying please wait for the host to start meeting.
Are you in the right one?
You use the other number.
Hold on.
Yeah, you might be in the wrong Zoom.
I'm in the email. Hold on.
I have one. It shouldn't matter. I have one for Saturday and one for Sunday. It shouldn't matter, but I don't. I have to see you in my waiting room to let you in.
It's
yeah, I think the one in the email. I think the one in the email is for something else. Like, yeah, try the one in the Canvas.
So the one for tomorrow, what time tomorrow? Same time?
9 p.m. to 11.
Yeah, that's the one that's in the email.
I'll send that back out today if it's the wrong link because you guys should be able to access it.
I'm just gonna try to take the Zoom number.
You just jump through one question.
Yes.
Can I have the number, love?
Is that what you're saying?
That was my
The number is 849.
849.
Hold on, let me get the invite. Oh, what?
That's a different number. It starts with a 9.
Yeah, 950.
950.
0980.
0980.
8857. I'm not sure how that happened.
Yeah, I was trying to do it from the thing. That's probably how you're doing. I'm logged in. Thank you.
That's a weird number. That's definitely not my number. I don't know how that ended up on the Zoom, but usually I use the same number all the time. Okay. A client in a clinical research study has given informed consent. This means that the client has certain rights. These rights include which of the following?
Protection from harm.
See.
See.
Everything but D.
Everybody agree with that?
Yeah.
Thought C, D, E.
C, D, E.
C and E.
C and E, yeah.
C and which one, you guys?
C
and E. Protection from harm and consent knowledgeably. So we're talking about clients' rights.
Okay, yeah, right.
In a clinical research study.
Wouldn't it be A too?
Confidential.
Once you give consent, like some things may be released about confidentiality. We probably wouldn't release exact details, but there may be some things released in those, because remember, it's research, it's clinical research. So only certain things in that clinical research would be able to be confidential if you're trying to share study results.
Does that fall under HIPAA, confidentiality?
Yeah, that would fall more under HIPAA than it would under clinical research.
Ms. Loesch, can you go back 2 questions up? I think you like accidentally went past 2. There were 2. Oh no, we did that one. Okay, never mind.
Which of the following statements are true regarding nurse-initiated interventions? 1, they promote independence with activities of daily living. 2, they give clients information they need to make informed decisions. 3, they resolve, prevent, or manage a client problem. 4, they require a physician's order to be carried out. And 5, they aim to treat or cure medical diagnoses.
C.
See, they resolve, prevent.
Let order apply.
No.
Say what? Say that again, Mike.
It should be more than one. That's one.
It's A and C.
Okay, it's actually A, B, and C.
Okay.
Makes sense.
The selector that applies is very tricky.
Can you go back to that one again? I was writing down the answers. You said A, B, and C?
Yeah.
Yes.
Yeah.
Okay, they resolve.
Miss Sue, are you going to send this recording too?
This recording will probably be on YouTube.
Okay.
Trying to get all the recordings up on there now. Just had a little bit of problem with some of the recordings. They didn't want to act right, so.
Are we in these recordings when you submit them? Because we sound a little crazy.
Sometimes
Yes,
you
we
are in
are.
the recordings. So yes, if anybody has
see
a
my
problem with
face.
that, please let me know. But unfortunately, if I cut people out of the recordings, then the whole recording will be cut. That's the only downside to it. So
Pitch it down.
listen, if I'm agreeable to go on there, and I sometimes sound worse than yo. So
No, I was just saying, because just imagine somebody trying to read or listen, and they're like, oh my gosh, really? Oh my gosh, really?
happened, but I just did something. Let me just stop this for a second. I hit the keyboard on the floor and I did a whole bunch of something. God, what did I do? pause this recording for a
I
second.
didn't even.
Okay, so the nursing instructor is teaching a group of students how to correctly write nursing diagnoses. Which of the following nursing diagnoses are written correctly? So we have risk for injury related to cluttered home, self-care deficit related to immobility, ineffective airway clearance related to 20 years of smoking, diabetes mellitus related to self-care deficit, and bronchitis related to ineffective airway clearance.
No, E,
A, B, and E.
E, B.
A, B, E.
Risk for injury. A.
A, B, C.
A, B, and E.
And C.
So remember, you can't have a medical diagnosis.
A,
in
B,
nursing
C.
diagnosis.
A,
So
B,
the other
C.
day when I gave you guys a nursing diagnosis, I gave it to you wrong, but you can't have a medical diagnosis in it. So it's only going to be A, B, and C, correct?
A, B, C.
Okay.
What did you say? A, B, and what else?
A, B, and C.
Because they are not medical.
Michael.
A, B, and C.
Yeah.
You said it like 12 times.
I guess.
If she say it 10 more times, it's okay. A, B, C.
No, because everybody was talking, so it's kind of hard to hear and decipher.
It's
what that
okay,
is.
Miss Bell. It's okay.
1, 2, 3, A, B, C, 1, 2, 3. I'm taking less of money away.
How do I turn my volume up while we're screen sharing, while we're looking at your screen? I can't turn the volume up on my computer.
I have no idea unless you use one of your F2 functions. Look at F2, F3. They might have a volume control.
Yeah, like right above the 7.
F8. 8. F8.
So
But
it's
if I
different
exit
on
out, it's
every
gonna kick me
computer, but
out.
it should be one of those F keys, and it'll have a picture of a speaker with a plus sign. All right. Which statement by a nurse meets a third level need according to Maslow's hierarchy of needs? So again, you have to think about what are the different levels here, right? So we have physiologic, then we have safety and security, and then what?
Love and belongings.
Okay. I see that you have applied makeup today for the first time since your surgery. I am your nurse for the next 12 hours. You can use your call bell to page me. Your wife can visit every day between 10 in the morning and 8 at night. A physical therapist will be in today to complete an evaluation.
Wife can visit.
Well, it depends on how cute that physical therapist is.
Oh, Lord.
There we go.
Amen.
Wife can visit.
Yes.
See?
All right, so supporting a patient's need for self-esteem is the fourth level. Self-esteem, wait a minute. Providing information. Didn't it ask about the third level?
There's a...
Oh, okay.
Yeah, break it down.
Providing information to a client who is providing care and how to call for help when necessary supports the need to feel secure and safe. Explaining when a spouse can visit help meets the love and belonging needs, which is the third level. And then meeting a physiological need such as activity is a first level need. Sorry, it threw me off there because of the first statement. Like, let me read. Okay. The prospective nursing student is trying to decide on a nursing program to attend. She is examining the nursing philosophies of each program. She believes that the essence of nursing is to help the person adapt to changes in physiologic needs, self-concept, role function, and relations. Which of the following theories would most likely meet her needs?
You'll see.
Is it B?
It's C. I know it's C. I just guess. I guess it's C.
It's Roy's adaptation theory, B.
B?
Yes.
All right, the primacy of caring is a model proposed by Patricia Benner and Judith Rubel. Caring is central. Roy's model is to help the person adapt to changes in the physiological needs, self-concept, role function, and relations. The goal of Orm's theory is to help the patient perform self-care. Rogers' theory considers the individual as an energy field coexisting within the universe. Which of the following choices correctly lists client needs according to Maslow's hierarchy from the most basic to the higher level of needs? Which is the correct order?
3, 2, 4.
No.
No.
No, there's no 2 actually.
3, 5.
Self-actualization is last.
3, 5, 4.
1 and 2.
3, 5, 4, 2, 1.
B.
3, 5, 4, 2, 1.
Yes, 3, 5, 4, 2, 1 should be correct. Physiologic, right? Safety, love and belonging, then self-esteem, and then self-actualization. Okay, so I need food and water and oxygen. Then I need to be safe. Then I need somebody to love me. Then I want to make sure that I'm confident and I feel good about myself. And then I want to recognize things that could help me improve and get better at it.
Just hoping to see this question for the exam, seriously.
I don't know that you'll see any of these questions on the exam. These questions are more about learning the topics and stuff. So I don't know that you'll see them on the exam.
No, it shouldn't trick that sort, because exam question can be a little bit tricky sometimes.
But you have to read what the question is asking you. Okay, and that's where nurses fall apart, because they're rushing and they have this anxiety and they don't really read what the question is asking them. So you really want to get into what is the question asking me. All right, so on this one, the
reflective.
This action is considered which type of practice?
Michael, let her do it before you answer.
So it's asking you which action is considered this type of practice, okay? So the physician orders an IV pain medication for a client. The nurse caring for the client administers the medication through the IM route. The nurse learns from the error. This action is considered which type of practice? So when you learn from your errors, I guess somebody put, I don't know why they put the rationales on.
The rationale already showing the answers.
I know. Not on all of them, just on that one, I think. It looks like somebody's
but
got
then
them on
we got all right.
Unbelievable. Why would they do that? I should have looked at this beforehand. I would have seen that. All right. There's only like 4 more slides on here anyway, so I know we're going to go over some other stuff real quick. All right. Which nurse is demonstrating the assessment step of the nursing process? So A, the nurse who observes the client's pain was relieved with pain medication. B, the nurse who turns the client to a more comfortable position. C, the nurse who asks the client how much lunch he or she ate. Or D, the nurse who works with the client to set desired outcomes.
C.
C.
I always get tricked up with these ones because it's like when you're assessing, you're kind of like when it says the nurse who turns the client to a more comfortable position. Like you could have walked, well, no, because that's actually doing.
Okay, so let's talk about them. Let's talk about them for a second. So A is an evaluation, right? Really observing the client to see if the pain was relieved. So she's kind of evaluating there. The nurse who turns the client is implementing.
Amazing.
Okay, when you ask the client about how much lunch he or she ate, you're doing an assessment and you're collecting data about that assessment. The nurse that works with the client to set desired outcomes is planning.
Assessment.
So we're collecting, organizing, validating, and documenting data. That's why it's C. All right, A is just collecting the data.
And D is the plan of care?
Yes, D, you're planning. You're planning the goals, you're planning the outcomes. You're setting the outcomes, so you're planning there. The nurse instructor is teaching a group of students about the nursing process. In which order will the following activities most likely occur? So now you're thinking about your plan of care. So what are you going to do first?
Establish.
Is it B? Establish.
Or establish a database.
Establish a database. I got a plan of care.
Yeah.
Measure the outcome and modify the care plan.
1, 3. B.
Okay, B, correct. Which of the following is an example of delivering culturally competent care? Seeking assistance from the charge nurse so the client may accept care. Allowing the client to make decisions about care. Coercing clients to participate in care that conflicts with their belief, or providing care with the knowledge that the provider's culture is superior to the client.
Providing care with the knowledge that the provider culture is.
So B, allowing the client to make decisions about that care would make the most sense. Because even if they're, they tell you what culture they are and all, you don't know what exactly rules they follow with that culture, especially in America. They could be mixing a little bit. They could be following some American traditions and still following some of their cultural traditions. What's a perfect example of that? About people that have migrated to America from overseas, right? When you were in your country, did you celebrate Christmas? Did you use the type of electronics? Did you do all this other stuff that the kids here do now? And now that your kids are over here in America, they want to do everything that these American kids are doing, right? You might still want them to be part of their original culture, but you're probably put between a rock and a hard place because they're wanting you to let them do that like every other American kid does, right?
Right.
Eddie Murphy sometimes reminds me of this, and a couple of other comedians, right? Because in certain cultures, kids don't curse at their parents. They say white folks always let their kids curse and talk to them any old way, right? And then he'll be joking like, I had a black mama. If I did that in my house, I would have been slapped in the next week. So it's just an example of how different cultures allow different experiences. But when your kids get around other cultures, they want to act like those cultures. And you see that happening with kids today now. It's hard to separate kids in America from one culture to another because they all kind of act alike now. They've kind of blended, right? You agree or not?
Yeah.
I agree.
Kids have kind of blended today and they all try to act like each other.
Yeah.
I mean, you have a few that are separated, but for the most part, they all like video games. They all want electronics. They all want Christmas presents. None of them want to work. They just want to put the hand out. You make them work, they'll work, but they'd rather get it for nothing, right?
Yep. Every day.
Lord, today. Listen to this.
Which events is an example of never events?
Never.
C.
C.
Never.
So D is the answer for this one, and let's look
I was
at
about to
it.
say D, yeah.
Oh.
Yeah,
You didn't
because when
say
you're,
it.
I'm thinking about birth and delivery. I mean, I don't know. I'm thinking about a lot of things, but I was definitely picking D.
I was thinking C.
Like from the
Oh,
hospital.
it's
I was
actually,
thinking C too.
this does say C, but it lists D. I don't know why.
I think we have this question and it says C.
C is the correct answer, not D.
No, that's what I said.
I was looking
Yeah, I
at
was
D and I was
thinking D.
wondering why D would be wrong, because I think you could definitely discharge an infant to the father. What if the mother had to stay in the hospital?
Right.
Right.
But we definitely would never want to perform surgery on the wrong client. And this actually almost happened to me as a nursing student. And my instructor really embarrassed me in a situation where she shouldn't have, because my client, when I was in nursing school, we had to go to the hospital the night before and pull our clients' records and do the research on them. And my client was a elderly patient with dementia that was having hip surgery the next day for a fractured hip. And so when I went home and when I came in and did the chart review, and then I went home and I wrote all my records and everything, and she was supposed to be having surgery on the left hip. But when I came in the next morning to get the chart, I couldn't get it right away because the doctor and the surgeon and all them had it. So I went into my client's room, and when I went into the room, I saw that the right hip was actually marked for surgery. So I'm like, oh my God, I wrote everything down wrong. That's what I thought. So I'm trying to get the charts. I can't get the charts, and I don't want to say anything because I don't want to be this stupid student that said, oh, you guys made a mistake and marked the wrong hip. So I go back to the charts and I pull the charts, and sure enough, everything in the chart does say left hip. So then I go to my instructor and I'm like, I don't want to cause, a problem or whatever, but I noticed that in my records and everything, and when I went back and reviewed the chart, that everything says left hip, but the right hip is marked. So then, like, my instructor, instead of just pulling the charge nurse to the side, like, and saying, hey, my student saw this in the chart, maybe you guys want to check it out, she went to the nurse's station and made like this big blow up thing. And I was just so embarrassed. Like, really, that's not the way you would handle that. But what happened is when the records came in, whoever did the records accidentally transcribed the wrong information on the records, and they actually did have the wrong hip marked.
So you helped them.
Yeah, I mean, it was just, it was crazy, but it can happen. So you always want to pay close attention to what's going on, because you never know when something's going to go wrong. And this is why they say right before surgery, you're supposed to have a surgical time out. This is something that Healthy 20 people really recommend, is that you have that surgical time out. We go back, we look at making sure we have the right patient, making sure that everybody's on the same page for what surgical procedure is being performed and where the surgical procedure is supposed to be being performed, so that we don't get the wrong patient or we don't operate on the wrong part. All right, the last one is the Nurse Practice Act protects the public by broadly defining the legal scope of the nursing practice. Which of the following nurses is practicing within their scope? A registered nurse caring for a client on the surgical floor with writing a prescription for a narcotic for the client.
C.
A registered nurse caring for a client on the surgical floor discontinuing a pain medication because it doesn't work for the client. A registered nurse caring for a client calls an outside pharmacy to find out the name of a narcotic a client is taking. Or D, an LPN performing an admission assessment on a client admitted to the medical floor at the local hospital diagnosed with bowel obstruction.
C.
C.
Okay, C is correct. Okay, as a registered nurse, you cannot write a prescription and you cannot discontinue a prescription. That requires a doctor's order. You can withhold it until you talk to the physician, but you cannot discontinue it. All right, and if you're an LPN, you cannot be doing an admission assessment on a client admitted to a medical floor. Why?
Does it?
to be done by an RN first. The RN does the initial assessment because why is that? I don't know.
Because we don't have assessment skills and it's more in depth than our skill level.
It really falls to the fact that your patient is not stable. And LPNs can only take care of a stable client. But yes, the RN should be doing the assessment. But do we ever admit stable patients to the hospital?
Yes.
No, we don't. We don't admit stable patients to the hospital.
Oh, sorry. No. Yeah.
Because insurance isn't going to pay for it. So technically, when we're admitting someone to the hospital, we consider them to be in an unstable state.
Unstable.
We don't even work in a hospital no more.
Well, there are some hospitals I think that still use PNs, but they're few and far between. Like
like rehab floors, not no med surg floor, not no major floor no more.
Not on the med surg floors anymore. That's true, but they do use them. Okay, things that we did not cover that you guys would like to go over. Anything that anybody else would like to go over?
I do quantitative and qualitative.
Also, what's going to be on the midterm? Like, is it going to be from chapters 1, like all the way
through 18, 1 through 17? Is it 17 or 18?
Chapters
It's chapter 13.
Chapters 1 through 7 and chapters 13 through
to
18.
18. That's 13 chapters. Wow.
So, okay, so everything up until this point.
Yes. I would say the focus will be more on the questions that you haven't had. So it'll be, somewhat of a percentage from the stuff that you've already seen, but the heavier focus will more likely be on the questions that you have not seen yet.
Which is 13.
On the chapters that you have not seen yet, which are going to be 13 through 18, right? Those are the ones that you have not been tested on yet.
So, how many select that apply we having?
If it's 100 questions on the exam, 20 of those will be select all that apply.
Those are the hardest ones.
Yeah.
So do you get a half a point for maybe selecting 2 out of 3 or, 2 out of 4? Or are they just going to mark the whole thing wrong?
Yeah, I'm not sure if they give you partial credit or not for the select all that apply. Traditionally, as far as I know, if you don't get them all right, you don't get the question right. But I noticed on the quizzes that they did give you guys partial credit on the actual quizzes, but on the exam, I don't believe that you get partial credit.
One wrong or wrong.
Michael.
Yeah. So Sunday 9. You said 9 p.m. to 11, right?
Tomorrow, yes, it's going to be 9 p.m. to 11 p.m.
It's the same thing you went over today, or something different?
No, it'll be the same stuff. Trying to reinforce it to people.
Okay.
Well, if you do practice questions, can you do more of select all so that the people that's having a hard time with the select all will be able to better answer the questions?
Trying to, I'll pull up some questions, that I can find that I can give you guys exposure to. I don't have a huge select all that apply database that I can give you guys practice questions to because we can't compromise the exam.
Okay.
So like the questions I gave you guys before, those are just practice questions to work on them. And I don't expect to see those questions on the exam. So I was able to give those to you.
Mm-hmm.
But I can't give you anything that might be on the exam because it would compromise the exam.
Okay.
Miss Susan, are you going to go over qualitative and quantitative?
Yeah, that's what I'm trying to pull up now.
That's very confusing.
Well,
go ahead. I'm sorry.
Go ahead, Mike.
Eddie. Not me, Eddie.
Eddie. I meant to say Eddie.
I was just wondering, you say you was going to do some lecturing. I know you don't have time for it, correct?
I did record some lecturing for you guys that I'm going to put onto my YouTube channel.
Please, because I think I prefer your lecture better.
Okay.
Me
So
too.
I did. I'm actually only have like one
I
slide
thought I'm the only one
left
because
on
your lectures they
18.
on point. They on point. I think I'm the
Yeah.
only one.
I only did have one slide left on 18, but I did do the lectures for 16, 17, and 18, which I'm going to put on there for you.
You gonna send in an email or on YouTube?
I'll send you the YouTube links in an email. Yes.
Please.
Oh, it's chapter 2 is qualitative, right?
Can this be continuous?
Yeah.
What you mean? What I do in the course?
No, about the lecturing. I prefer your lecture better.
Okay. Well, I'll do the best I can, Eddie.
Thank
You know, I try to do as much as I can for this course, but it's not my only horse that I got to ride. So
Just your lecture is more it's more clarity and more precise. That's all.
okay, no problem. I'm gonna do the best I can for y'all. That's my intent always.
Thank you.
Why isn't this coming up? Let's see.
Yeah, I'm seeing new faces on this and
Oh, Michael.
yeah, I don't know.
Michael.
No, I'm just seeing new faces and strange faces, some strange faces, other
Some
stuff.
strange faces.
Yeah.
That's because it's other classes.
Okay. Nice meeting you guys. Welcome to
So that's your day. It should be your day Ewing class. That's what you should be
No,
saying.
Miss Lowe, I'm seeing new faces. I know my classmates, you know. So if I see new thing, I have to voice out to make sure.
The day, what you see is the day people coming in.
No, I didn't see all
Day
these
L
faces.
to R.
Mike, if
Oh,
somebody,
been here. I've been here. Ewing Day L to R.
Mike, if somebody can smack you, they'll go.
Yeah. Oh, thank you. Let me
reply.
reply. Please. Nice meeting you guys.
Oh God, save us.
Okay, so quantitative research. This is concepts of basic and applied research, okay? So it's called like pure or laboratory research. A lot of this is going to be done in a lab setting. For qualitative, okay, this is conducted to gain insight by discovering meanings. All right, so it differs a little bit in the types of research. So with quantitative research, you're going to see things like a variable, which is, you know, we study different values that can be measured. You'll see things like dependent variables, where a variable is being studied to determine the result of that variable, and independent variables. You might see a hypothesis and data.
It's not like the sound like quantitative as a subjective.
Quantitative is going to be more like descriptive research, correlational research, quasi-experimental research, experimental research. So let me see if I can give you a better description there.
Now you just confuse me.
I'm going to try to see if I can get you a little bit better description.
I was just thinking like the qualitative and subjective are kind of similar.
So when you think about quantitative data, think about numbers, okay? Because it's information about quantities and numbers, and qualitative is more descriptive. So it talks about phenomenon. It talks about observations that cannot be measured, like language and stuff like that.
So why wouldn't a questionnaire be a form of quantitative data, like a questionnaire?
Well, it depends on what the questionnaire is asking.
Because I thought like a questionnaire refers to like numbers, counting a minute, how many people said what, how many people said what.
Like a closed survey, things like that would be a sort of quantitative measure or method. All right, but it would have to include experiments or observations recorded as numbers.
So like quantitative, would it be like the amount of data, whereas though qualitative will be like
the value of the data?
Quantitative is like, I just want to blank. Like quantity is the amount of the data, like, and qualitative is the, I can't find the word I'm trying to say.
Let me see if I can pull up this
like the
link for you guys, and let's see
quality of it, like how effective it is, like how good it works.
Let me see if I can get this, and let's see how good this is. So let me get me up here.
Because quantity is how much you get. Quality is how good it is.
Well, quantitative usually talks about numbers and data, whereas qualitative talks more about a prescription, about a description. But I'm going to see if I can pull up a video that maybe explains it a little bit better.
When doing research, you often have to choose between quantitative and qualitative research. In this video, I'll explain the differences between the two. Hi, I'm
You
Jessica
can't see it.
here to help you achieve your academic goals. Let's start with the differences between quantitative and qualitative research. Quantitative research allows you to test hypotheses.
We can't see
So you
it.
can
Hold on, I'm getting there. Okay, can you see it?
Yeah.
Yes. Thank you.
Hi, I'm Jessica from Scribber, here to help you achieve your academic goals. Let's start with the differences between quantitative and qualitative research. Quantitative research allows you to test hypotheses, so you can expect to see data collected with this approach will mainly be expressed in numbers and graphs. It also requires a larger sample size. These numbers are then analyzed through math and statistical analysis. On the other hand, qualitative research allows you to formulate a hypothesis. So yes, opposite to quantitative research, this approach will yield data that's expressed in words, and also require fewer respondents. The data is then analyzed by summarizing, categorizing, and interpreting. All right, now we know the differences, but when to use which? It's very simple. If your goal is to confirm or test a theory or a hypothesis, you're most likely going to opt for the quantitative approach. But if you want to understand or explore an idea, then you should go for the qualitative approach. There's also a third approach, which combines quantitative with qualitative. And this is called the mixed method. Let's see how it applies in a concrete example, shall we? Say we want to find out how
I don't think you guys need the rest of that. I just wanted you to understand that simple explanation there. So we use a phenomenon or words when we're talking about a qualitative. We're trying to explain something that's happening, a philosophy that describes experiences as they are lived by the subject being studied. So that analysis will be more about that as opposed to some numerical data that we're trying to test on a hypothesis. Okay, does that make it more understandable for you guys? Hello?
Somewhat. I'll probably just have to go back and reread.
Let me see if I can find examples, okay?
Okay.
Yeah, because like when I read it, it's like, okay, but then when it's in a question, I'm like, ooh.
Do you have a question or two we can go through? Is that maybe?
Like, I hate to keep repeating myself, but I know like one of the questions, it said,
And it'd be select all questions.
yeah, and it was like questionnaire fell under qualitative. So I just wanted to know like why.
Yeah, and without seeing the question, I probably won't be able to answer that part for you.
It was on our quizzes. It was on one of the quizzes. I think it was like chapter 2 quiz or something like that.
I'm sure she got it.
It was on your chapter 2 quiz? That's where it was? On your chapter 2 quiz, you're saying?
I'm getting it now. I'm getting it now, yeah. Because I saved all my quizzes. Like I print them out after I finish them. So it was on chapter, which one was it, Samika?
Chapter 2 would have been the evidence-based practice one, so that's...
It was, yes, it was chapter 2. This quiz was really tricky. Really tricky. So it was number, let's see here. Okay, yes. So number 14.
On chapter 2, okay. I'm trying to pull it up now.
Number 14 and 15 are questions about qualitative and quantitative.
Okay, which statement best describes qualitative research? So studies that are conducted in natural settings, because quantitative are usually conducted in a laboratory or a pure type of setting. And it's usually collected from small group numbers, not large, so that's why B would be wrong. C, collected tend to be numeric, and that would be more quantitative. D, the research design is systematic and subjective. That would be true about a quantitative. And E, the research is done in a controlled lab setting. That would be true about quantitative, not qualitative. All right, the other one says, which of the following phrases would be found in a report of a quantitative study? Okay, that's just saying that responses to the questionnaires were analyzed and interpreted. So that's why you think that that wouldn't be, and that's actually quantitative.
Yeah.
Not qualitative. Remember, qualitative is more about statements and phenomenons. Quantitative would be about questionnaires. What was the answer?
You marked it wrong. I put
a
C.
convenient sample was chosen. That's why, because we remember I said we use samples to look at with the quantitative. C could be either one, because we could use a questionnaire. We might not necessarily be looking for numerical data just because we're using a questionnaire, right? And can other topics be analyzed other than numerical data?
Yeah.
Yes. But for A, we would be more likely to use a sample and put that sample in the lab and do that quantitative study. Remember, qualitative is more about phenomenons and like B.
Okay. What about number 12 on this quiz?
Hold on one second. So maybe this would help you understand it better. If you start with yourself as an example, to acquire qualitative data, you would think about identifiers like the color of your clothes, the type of your hair, the shape of your nose. For quantitative, you would consider measurables like your height, your weight, your age, and your shoe size.
Yeah, that was a good one.
Okay, quantitative data are used when the researcher is trying to quantify a problem or address what or how many aspects of a research question. It's data that can either be counted or compared on a numeric scale. For example, it could be the number of first-year students at a college or the ratings on a scale of 1 to 4 of the quality of food served at a cafe. The data are usually gathered using instruments such as a questionnaire, which includes rating scales, or a thermometer to collect data. Statistical analysis software is often used to analyze quantitative data. Qualitative data describes qualities or characteristics. It's collected using questionnaires, interviews, or observations, and frequently appears in a narrative form. For example, it could be notes taken during a focus group on the quality of the food at the cafe, or responses from an open-ended questionnaire. Qualitative data may be difficult to precisely measure and analyze. The data may be in the form of descriptive words that can be examined for patterns or meaning, sometimes through the use of coding, which allows researchers to categorize qualitative data and identify themes that correspond with the research question to perform the quantitative analysis. So does that make it a little more clear? Okay, I didn't get an answer there, so I'm gonna assume it did.
Yeah.
All right, number 12 you wanna look at now? On quiz 2, right?
The same quiz. I mean, yeah, I was just confused because like I thought you always follow the hospital policy.
So because we're talking textbook, and I actually got this question wrong myself, okay? Because I'm thinking real world and they're talking
here and now. Yeah.
Okay. In the textbook world, we never want to do more harm than good to the patient. So in this case, it's saying because there's no evidence to support the practice, that it could be more harmful than the patient to the patient than good. So this is why you would want to do research and present it to the policy committee to make sure that whatever we're following really goes along with the evidence. Okay. I mean,
thank you for explaining that. I get it. That's the textbook answer.
yeah.
I get it.
And the reason why I picked this is because, at my facility, what I teach people all the time is you have to follow the policy, because if you make a mistake and you're following policy, I got you covered. But if you're not following policy, I really can't help you at all. So in my mind, that's why it went to the wrong answer in this question. And yes, we always test the balloons. Why? Because I've had plenty of balloons when I've tried to take the catheter out that won't deflate or leak. You put the catheter in and now it leaks and now you got to pull it back out, right?
Right.
So, you think about all that stuff when you've been a seasoned nurse and you interject it into your questions. But what you have to do is think textbook, think NCLEX, and don't interject real world scenarios into your questions because it'll cause you to get them wrong.
Gotcha.
Anything else anybody needs me to explain? Okay, guys, I'm going to conclude the session then, and I will be back on tomorrow night at 11.
9 or
I mean,
11?
9. 9. I'm going to send you guys a new link, though, for 9 o'clock tomorrow night. I don't know why it gave me a weird link. It might have been because of the way I was setting it up. I don't know.
Thank you so much.
But
Yeah, thanks, Miss Sue.
no problem. If you can't get into one, do the other. And everybody has my phone number. If you can't get in, call me, email me, whatever. I try to monitor the email during the sessions so that nobody gets left out in the dark.
Okay.
Do
All right?
you, is your telephone number on Canvas or one of the emails?
It's on all my emails, or it should be on my emails at the very bottom. It's 609-207-3842.
Oh, did you put your
name in 207-3842.
207-3842?
Yes.
609. That, I'm sorry, is that your cell or your office?
Well, that goes to my office, which rings to my cell.
Okay, cool. Thanks.
You're welcome. All right, guys. Have a good Saturday.
Good night. See you later.
Good night.
Good night.
Thank you.
Good night. Thank you.
You're welcome.
Bye.
All right, bye, Miss Loesch.
Good night.
Thank
Bye,
you.
Miss Loesch.
Night.
Why is that if Michael talks, that's the time people laugh? I don't know, Miss Loesch.
Don't worry, Michael. Never
Okay.
worry about other people. Just worry about Michael.
I know. Thank
The way
you.
God wants you to live, other people don't matter.
I know. Okay. Thanks.
All right. Bye-bye.
Yeah.